Hello everyone, my name is Anna Gelino. I'm the infection preventionist for the Arcadia family of companies. Today I'd like to demonstrate to you all the proper methods of donning, which is putting on, and doffing, which is taking off the personal protective equipment, or PPE, for those of you in the home care setting. It's important that we pay special attention to the proper donning and doffing techniques, because if it's not done properly during the COVID-19 pandemic or any time, it is possible that you will self-contaminate and risk getting sick with the disease. So the very first thing you want to think about when preparing yourself to enter a client's home who has confirmed or suspected COVID-19 is to ensure that you are ready to go in. You want to make sure that your uniform is free of any extraneous objects. Don't bring with you things that do not need to go into a client's home. You will not want to wear any jewelry during this time. Also, ensure that your pockets are not full of items that are unnecessary and may fall out during care. Think about your hair. If you have long hair, you'll want to make sure it is secured tightly up and away from your uniform. Also, check your shoes to make sure that they're tied before you start getting ready. The next thing you need to think about is to make sure that you have all the proper PPE that you require. You would have been given the bags of packs of items, but do ensure that you have everything you need before entering. If at all possible, ask the client or family if there is an outdoor trash receptacle so that you'll be able to discard the used PPE in a safe manner. If not, you can also use a plastic bag. Place on the ground in the ready position to receive the used items. So now we're ready to don our PPE. The very first thing you need to do is to use your alcohol-based hand rub. Place enough hand sanitizer or hand rub so that you are able to adequately cover all aspects and all surfaces of the hands. You need to rub in all different directions to ensure that all surfaces are being covered. And you need to rub until dry. This should take about 20 seconds. Normally, during this time, you will have been wearing a cloth mask. So I'll put that cloth mask on as if I've had that on all the time. So after you've used your hand sanitizer, the very first item that you put on is the gown. Remove the gown from the container and inspect it so that you're sure it has all the parts that it needs, the ties, and that there are no holes present. Place the gown on so that it's going to cover all parts of your uniform and fits properly. You can take the ties, tying in a bow in the back. If you do happen to have another staff member with you, it's fine to let them tie you up. The buddy system is good with PPE if it's at all possible. Next, you'll want to place your shoe covers if you have them available. Take the shoe cover and open as wide as you can, taking care not to contaminate your hands by touching your shoes. Then place the second one. If you need to brace yourself by leaning against a wall or sitting down, you may certainly do so. Because we're wearing a cloth mask these days, when you're out and about, whether in the car or on public transportation, you're going to need to change. You cannot wear a cloth mask when you're going into the home of someone with confirmed or suspected COVID. So again, you're going to need to perform your hand hygiene before you touch that mask. Remove the mask by leaning slightly forward, take the ear loops, and remove away from the face. As you've already been trained, you can secure the mask in a paper bag when it's not in use. Because you've touched the mask with your face, you'll need to perform hand hygiene once again before putting on your surgical mask. So when you're going into the home of someone with confirmed or suspected COVID-19, the best choice of face mask is actually the N95 respirator mask, or you may be also choosing a KN95 respirator mask in this case. Only if you have been trained and properly fit tested for the respirator mask, and if one is available, that's the best choice. However, if one is not available, it is also an acceptable alternative to use a regular surgical or isolation mask. So I'll demonstrate that one today. The surgical mask will have a colored side and a white side. The colored side belongs facing out so that people can see the color. The white side will go towards your face. Handle it by the ear loops, taking care to cover your entire nose from the bridge of your nose to your chin. Then use 2 hands to mold that metal nose piece to your face to ensure a proper fit. You don't want to pinch. If you pinch with one hand, it can cause gapping, which allows air to enter. Next, you'll want to put on your eye protection. There are 2 types of eye protection that you may have. So I'll show both to you now. One is a disposable face shield. This gives full protection from the face. When you put it on, you'll want to handle it by the straps or headband. Place it fully over the face, like so. This is a very good choice because it also provides protection over your nose and mouth. When you remove a face shield, you'll want to take it off, handling only the straps. Never touch the front of the face shield. If you do not have a face shield, the other option are the goggles. The goggles are just placed on like glasses, handling them by the earpieces or the sides. Place them on over the mask. You don't want to use the goggles to scooch your mask out of the way. That's incorrect. Ensure that your mask is properly placed. Place the goggles on top, like so. When entering the apartment, you will never want to adjust the glasses. Don't touch the front of them as they may be contaminated with the virus. Also, before you go in to give care, you want to make sure that they're not going to fall off your face. So make sure to do motion to ensure that they're properly placed. Next, we'll wash our hands again using our hand sanitizer. Covering all the surfaces. And this is to make sure that our hands are clean again before we place on the gloves. Place your gloves like you normally do. 1 pair is sufficient. Always, when wearing a gown and gloves together, you need to make sure that you're tucking the sleeves. And that's so that when you're providing care, there won't be any exposed area of skin. So take the time to do that properly. Now I feel ready to enter the home in order to provide care. If you do happen to have a buddy, another staff member with you, use the buddy system to check each other out to make sure that everything has been placed correctly. So this is the most preferable way. If you can place all of your PPE before entering the home of the client, that's the best scenario. However, there may be the cases in home care where that's not always possible. If it is not possible for you to put on all of your PPE before entering the home, it is still preferable to ensure that you have your medical grade mask and your eye protection on before entering the home. Once you have those, if you knock and allow someone to enter and someone allows you to enter, ensure that the entryway is clear. Ask the resident and or family members to move back about 6 feet to allow you to enter the home, and then you can place the rest of your PPE, like your gown, your shoe covers, and your gloves prior to giving care. So I've just finished providing care to a client with confirmed or suspected COVID-19, and I'm ready to exit the home. Best case scenario is to exit the home completely and doff your PPE here outside. However, in home care, that may not always be possible. There may be the occasion where you're not able to completely doff the PPE outside the home. In that case, it's best to again ask the family members or the client to move at least 6 feet away from you. Ensure the entry area is clear. Have a trash receptacle inside near the doorway or a plastic bag like we have out here. At that time, you would be able to doff your gloves, your gown, and your shoe covers, but it's still preferable to exit the home while still wearing your mask and your eye protection. So let's move through the steps of what it would be like to doff your PPE completely outside the home. That way we can look at the technique. This is one of the most important things that's necessary to do properly to avoid self-contamination and the risk of becoming sick. The first thing that you want to doff is your gloves. Gloves are always the dirtiest. The way to doff is to ensure that you pinch with your dirty gloves from the other. You then carefully peel the glove inside out off of your hand. You can ball up that glove in the other hand. If you can expose your skin, to try to use then a clean finger to insert and remove. Then discard in your container or in your bag. At this point, you can remove your gown. This is the hard part. Carefully step, taking care not to touch your face like this, or touch your hair like this, or touch your back like this. It's important that you carefully reach for the strings and untie. There's also another method for taking off the gown that rips the gown. If you know that technique, that's also fine to perform. Just be careful to do so in a way that's not too forceful. There's a technique called the roll off, where you grasp only the inner portions of the gown and you gently remove it in a rolling way. Touching the inside of the gown is safe to do. It's the front, the sleeves, and the outside of the gown that can contaminate you. Using a finger, you can remove the gown carefully so that the outside portion is not touching your skin. And then you can roll it up bit by bit, keeping only the inner aspects close to you. Carefully roll it into a package so that it's manageable when you're going to throw it out. At this point, you can place it into the trash receptacle or your plastic bag. Next to remove, shoe covers. This too, if you need to brace yourself against the wall or sit, you can. When you take them off, you want to be careful just to use a pinching technique or one finger to just gently take off. Taking care not to touch the bottom of your shoes or the outside of the shoe cover. You can throw that one away, and then the opposite. Now, it's very important to perform hand hygiene correctly. At this point, you'll want to think to yourself, did I take off my gown correctly? Was there any chance that I may have contaminated my arms? And if you think you may have contaminated your arms, it would be acceptable at this point to use the hand sanitizer to sanitize your forearms if necessary. Okay, so next we're going to remove our eye protection. So as I said before, never touch the front of the eye protection. Use the sides to take it away from your face. At this point, these can also be discarded. Last is the removal of your mask. So bending slightly forward, using only the ear loops, remove the mask slowly away from your face and discard it as well in the container. Because we're in pandemic times and you'll be going out into the community, you'll want to replace your cloth face covering mask at this point. So again, you'll need to perform hand sanitizing. "20 seconds. And you'll replace your mask. Now, you'll need to take care of the garbage. So, gather up your bag, tie properly, and dispose of it into the trash receptacle that the client has offered to you. Do not take a trash bag like this into your own personal items, into a car, or onto public transportation. This is something that must be left at the home or in the outdoor trash receptacle of the clients. After performing, getting rid of your garbage, again, the very last time, you're going to perform your hand sanitizer so that you'll be safe to leave the area. Okay, thank you everyone. Please, if you have any questions about the proper doffing or donning procedures, please see your supervisor. And everyone, please be safe out there and healthy. Thank you for your hard work and taking care of all our clients. Bye-bye.